Every year, tens of thousands of people enter the Canadian prison system. Most arrive with complex health challenges linked to poverty, trauma, and drug use, shaped by systems that are not set up to meet their needs. In prison, the risk of illness and harm increases as people are barred from necessary health care. People regularly leave prison in worse condition than when they entered. In 2025, the HIV Legal Network published Hard Time Persists, exploring health and harm reduction policies and practices in Canada's prisons. We know that imprisonment is not a justification for the denial of healthcare, and everyone benefits from improved healthcare in prison.
In Canada, infections like HIV, hepatitis C are much more common among people who experience incarceration compared to in the general population. And prisons aren't separate from the broader community. People move in and out of prisons every day. And so what happens in prisons directly impacts the health of the public overall and the health of our communities outside prisons.
The right to health among people in prison in Canada includes the right to access healthcare, including harm reduction services. The United Nations Standard Minimum Rules for the Treatment of Prisoners dictate that people in prison have the same standards of healthcare that are available in the community. The World Health Organization, among other international bodies, has developed guidelines to achieve a rights-based approach to healthcare in prisons. They have called on states to implement an approach wherein healthcare in prison is provided by the Ministry of Health and not the Ministry of Corrections. Universal, voluntary STBBI testing, treatment, and counseling. Low barrier access to safer sex supplies, opioid agonist treatment, naloxone, and sterile needles and syringes, among other healthcare and harm reduction services. In Hard Time Persists, the HIV Legal Network found that throughout Canada, there are significant gaps in providing these fundamental healthcare and harm reduction services. People in prison are being forced to witness their own health deteriorate without recourse and in clear violation of Canada's human rights obligations.
Just filling out a form to see a doctor was a huge barrier and a hassle, right? Guards may come around and hand you a form and you fill it out. There's not a lot of privacy in that. There's tons of stigma and discrimination. Like if the guards don't like you, then, it could very well end up in you going to the bottom of the list, or your request to see healthcare just never makes it to them. And there's really no continuity from one facility to another or from one prisoner to another.
Hard Time Persists confirms that most prisons in Canada focus on safety and security to the detriment of fundamental health services with life-threatening consequences. Across the country, governments must urgently move to implement comprehensive health and harm reduction in prison, informed by experts and people with lived experience. Only then will we move towards a healthier and safer Canada for all.